I am a general practitioner, and a few years ago during my undergraduate internship, I experienced what I would call a miracle or something very close to it. I was in the 7th month of my internship in the gynecology department. It was January and we're welcoming new colleagues to our hospital. The gynecologist trusted me a lot, and that day she asked me to teach my service partner the basics of the rotation while she had breakfast. When we arrived at the emergency room, I was explaining the details of admissions in our area, and we saw a young couple come in. Both had very sad expressions. "We have a patient," I told my colleague. "Come on, let's admit her." During the interview, the woman handed us an ultrasound, which indicated she was 7 months pregnant. But it was a fetal demise. This meant the baby had already passed away in the mother's womb. We informed the gynecologist and she arrived immediately. She examined the woman and said, "Dear mother, your baby has passed away. You have a fever and an infection. I need to take you to the operating room. We will induce labor and deliver your baby to give to you. If the baby doesn't come by labor, I will have to perform a curettage, but I won't be able to give your baby because the procedure would cut it, and I don't want you to suffer more." The woman broke down in tears and nodded. The gynecologist began to give instructions. It was a very sad situation. We had encountered similar cases before, but this couple was special. It was their first baby. The young woman was 20 years old, and her husband was about 21. They were both very humble but very close to each other. The young man embraced her, and she cried as quietly as possible. "Notify the pediatrician, please," I told my colleague, just to have them present and calculate the baby's age. While she went with the pediatrician, we prepared the woman in the operating room and went in. The hospital where I rotated was very humane, and they demanded that we be one with the patient. So, I went in with the young woman and prepared her for delivery. I talked to her and stayed by her bedside, and after half an hour, the contractions began. When the time was right, we broke the membrane or the water, and the amniotic fluid, which protects the baby, was fetid and chocolate-colored, thick and bloody. It was nothing like the clear and crystalline fluid we expected. I took a sample and sent it to the lab as a protocol, returning immediately to the woman. We then moved her to the delivery area where the birth would take place. In the room was the head of the operating room nurses, the resident of social service nurse, my colleague and I, as well as the 2 undergraduate interns, the anesthesiologist and the gynecologist. Everything was ready and prepared. The gynecologist allowed me to attend to the young woman while she made some notes and prepared instructions for her, since a pregnant woman is always a priority in that hospital, and any negligence towards them is heavily penalized by law. As you will see in this case, it was a complete emergency. She had a high fever of almost 41 degrees, anemia, a deceased baby in her womb, and a generalized infection that could be fatal. Our baby was born, a girl but without vital signs, with cold, mottled skin and lips and hands with cyanosis, meaning a blue color, and she showed no reflexes. When we touched her, her skin began to peel away. According to the gynecologist, the baby had been dead for at least a week. The time of death was declared after providing all the necessary information to the police. Meanwhile, I finished attending to the woman who was crying uncontrollably, as the head nurse gently stroked her hair, trying to comfort her. We even heard the head of the department mention that the baby weighed 750 grams. We finished attending the delivery and handed the baby to the mother for her farewell. Then the young woman went to recovery, and we gave the baby to the nurses to prepare her for her parents. At that moment, we're called to the hospital's administration, and my rotation partner and I went up. The director and the head of teaching wanted to know what had happened. We explained everything in detail and stayed a while talking with our superiors, almost an hour in total. Then we're called again over the intercom, asking us to return to the operating room. Our first thought was that the woman's condition had worsened, so we rushed to the operating room. We entered in full white uniform, not caring if we contaminated the area or not. But what we found was the pediatric resident, who had wide eyes and a very serious demeanor, looking at me and asking, "Have you completed the baby's death certificate?" I replied that I hadn't requested it from the doctor yet, and he told me not to do it and to come in. When we entered the operating room, a colleague was intubating the baby and told me she didn't want the baby to remain in the hospital. The girl was. The color of her skin was pink, with no hint of blue. She moved her little legs and hands and opened her eyes to look at us. The pediatrician was in shock, repeatedly saying, "But she was dead," over and over. A chill ran through my body and my colleague asked, "Are you seeing what I'm seeing?" Then the head nurse and the cleaning staff supervisor came out and told us that before preparing the baby, they needed to finish their tasks. So, they wrapped her in a disposable surgical cap and placed her body in the back where cleaning supplies and formaldehyde were stored. Each of them continued with their duties, the cleaning staff to clean everything and the head nurse, along with her social service intern, to prepare the mother to be moved to the ward as per the gynecologist's instructions. No one attempted to resuscitate the little one, and the mother was left with nothing. The baby had no heartbeat, she was literally dead. She showed no signs of life, her skin was peeling and she wasn't breathing. The pediatrician had gone for breakfast and were in the administration talking, so an hour passed until the nurses had settled the mother to rest. They were about to embalm the little one. The cleaning supervisor was asked to take her to be bathed, and she recounted that when she delivered the baby and was about to wash her with cold water, the baby started crying. Thinking it might be her imagination, they placed her on a small table and saw her move. Quickly they called the pediatrician to confirm the baby was alive. The pediatrician told us it was probably just a survival reflex and she might not make it through the night. If she survived, the brain damage would be severe. We saw her when she was taken in an incubator to the pediatric intensive care unit, intubated with a central venous catheter. The baby was in very delicate health. As I mentioned before, I was rotating in gynecology, so I was in charge of the mother. Incredibly, she was moved to the ward, but the next day she had nothing. The lab cultures took a few days, and they reported that the mother was in a state of desperation. They reported an aggressive and deadly bacteria that was already in her body before the birth. However, subsequent tests showed no trace of the bacteria. The mother was doing so well that we discharged her after 7 days without complications. You might be wondering what happened to the little one. During my shifts, I like to visit the pediatrics department at night to check on her progress and talk with the pediatrician. Incredibly, the mother was in a state of despair, and they reported an aggressive and deadly bacteria, but they didn't find any complications. The baby gained weight and gradually improved. Over time, she became a beautiful 4-year-old girl, happy and with excellent development, without any neurological damage, just like any other child her age. You might not believe it, but there were many witnesses to this, and it changed our perspective on life. We learned a lot from this case, and I still can't find the logic or explanation, so I'll leave it to you to judge. For miracles, there is Guadalupe, the little one who defied the odds of medicine and exceeded our faith.